You just completed your internship. Now you are a new resident. What are the things you need to know? You need to do? What are the things you must avoid? In this video, I will highlight which things you must know to do as well as must know to avoid as a new resident. Regardless of your specialty, regardless of your geographic location of doing medical residency, these tips are applicable. Hi friend, welcome to this video. My name is Dr. Hoque. I'm an associate professor of medicine currently practicing in the US. I saw medical residency training in first hand both in Bangladesh and in US. So here I will focus on what I have learned, that what a new resident must do, know and avoid over the last 10 years of my experience. Tips number 1. First, know your role as a resident. Remember, when you are an intern, you may be seeing 6 to 7 patients, sometimes could be 8 to 10, depending on your hospital training program or geographic location. In contrast, when you are a new resident, your responsibility has been expanding now, right? So you are transitioning to a new role from intern to resident. So what are these new roles? First, although you are not writing all those notes as an intern anymore, your role has been expanded to knowing now all the patients of your team. Now you must know each and everything about your patients, whatever patients you have in your team. It could be like on an average from 12 to 15, sometimes could be 20, depending on your team capacity and depending on the call days. You also need to know what is your role for the interns. And now, as you are the resident, you must know how to work with the interns. You need to know how you will supervise them, as well as give them that space where they can learn, they can make decisions, they can grow, and you are there for them so that they have that space to take the ownership of their patients. So know how you can supervise the interns as a resident, as well as give them a space to learn and grow. And also you must know that this balance of supervision as well as giving the autonomy to your interns, it can depend upon the timing of their training. For example, if you are a new resident, your interns are very new, like, very early of their training, that time you need to give them more supervision compared to the almost end of their internship. For example, now, because this is July time, there are a lot of new interns, they are starting their internship. So the resident, if you are a new resident, that times you are also new with your role, they are new with their internship, so you need to give more supervision, maybe even offering them help, tell them that okay, if they need any kind of assistance of finding any order, placing any order, they should reach out to you. So tips number 1, know your role, know how to supervise and give autonomy to your interns. Now, second tips, although you are not writing all those notes, you are the captain of the ship. And what do I mean by the captain of the ship? You are not only knowing all the patients, what is going on with them, you are also communicating with your supervising or attending physicians. You are communicating with other consult teams. Like, for example, if you are a medicine resident, you need to communicate with all the other consultant teams. You also need to know who are the other team players, such as, physical therapy, pharmacist, occupational therapy. You need to know all of them, need to know how you can get hold of them, how you communicate, connect with them. And then also when you are like at your residency, you must know how you are like grounding with your attendings, because every attending physician or supervising physician style is different. So as the captain of the ship, as the senior resident, this is your responsibility to have clear and constant communication with your supervising physician, as well as have clear understanding of their expectation, how they want you to run the team. Because although maybe you are leading the interns, you are also, your hierarchy is still the supervising or attending physician is the on the top of that team. Now the third tips is code blue and rapid response. And as a resident, the responsibility of code blue rapid response is far more drastically different than your role as an intern. As an intern, most of the time you just followed what your resident told you. Maybe open the chart, put the order, do some chest compression during code blue, call the patient's family, right? When you are becoming a resident, that time, whenever the patient is having any cardiac arrest or code blue, any rapid response, most of the time you are leading that code blue or rapid response. Maybe your supervising physician is there. At the same time, majority of the time, this is the workflow and expectation that you, as the new resident or senior resident, should run the code blue or rapid response. So how you can be prepared for that? I have two tips for this code blue and rapid response. First, when you are like almost coming to the end of your internship, maybe 1 or 2 months before, ask your senior resident when you are in late part of your internship that will they be comfortable to allow you to take the leadership of a rapid response or code blue on an on-call day, because that will give you a first-hand experience. And if you do not know anything or make any mistakes, your senior resident is still there to teach you and give you feedback. And second tips is that when you are starting your residency, quickly go through the ACLS protocol very quickly, so that which things you need to do. For example, you can review the algorithm of pulseless electrical activity maybe within 5 to 10 minutes. So as a result, you have that knowledge and expertise, and very importantly, confidence that okay, what you need to do when you are leading the code blue or rapid response as a new resident. The next tips is on-call days. Again, as resident, regardless of your geographic location, your responsibility on-call day will be much more expanded than what you had during the internship. For example, as the new resident, you could be second year or third year, you are expected to triage patient from the emergency department during your on-call day. You are also expected to distribute the patient among the different subspecialty. For example, distributing to primary medicine team or distributing the patients from consultant teams to medicine team. Or maybe you are doing surgery, you are still triaging the patients, or maybe you have to take the call from outside transfer to triage the patients. So know that okay, on-call day will be busy, it will be hectic. In my expertise, if you have that expectation, which is realistic, that okay, this is my on-call day, I know that it will be busy, I will get so many calls at the same time, I have to admit new patients, you are mentally prepared. What else you can do for your expanded role as a new resident during your on-call day? Make sure you are having good sleep the night before, good breakfast, Have some snacks, lunch box, so that you are having nutritious food during the on-call day. Because it will be busy, and again, this is a great learning opportunity for you. Now we are going toward the tips number 5, that educational opportunities as the senior resident. Even if you are practicing in US or Canada, you have to learn during your residency training. And as a senior resident, remember, you are also now the educator, the teacher for the interns. You are the teacher for the medical students. Although maybe, on as soon as you are starting your residency, you do not have to teach them everything. At the same time, you must have that mindset that, okay, now you are expected to teach the interns and medical student. And as you know, when we share our knowledge, we grow more, we learn more. So, what you can do to learn and teach the interns and medical students? Maybe you can go through just a couple of common topics that you are interested to teach. You can also have some preparation for your in-training exam. As a result, you will have two goals. One, you will prepare for your in-training exam. And second, those knowledge you can utilize to teach the interns as well as medical students. Always remember, knowledge is power. So I hope you find these 5 tips helpful as a new resident, regardless of your geographical location, regardless of your specialty, you can utilize these tips as a new resident. If you have any other tips for a new resident, please put it in the comment section so that this community can learn from your expertise. If you like this video, please click the thumbs up button, share this video with your friends, colleagues, and please subscribe to this channel because you do not want to miss out these educational videos. And also, your liking, your subscription gives me inspiration to make more educational videos for you. We talk about preparation for in-training exams. If you are interested to learn what are the materials you can go through, what are the study books you can read easily to prepare for your in-training exam, click on this video. Thank you so much for watching. I will see you in the next video. Take care.